Hi, my name is Alyssa Cunningham, and I'm going to be giving a persuasive speech about Medicare for All. I would like to start off my speech by giving a quote from Senator Cory Booker. Medicare for All is the best way to ensure that every American has access to quality and affordable health care. As someone who's done a lot of research about the pros and cons of Medicare for All, I feel like I am qualified to give a pro endorsement on the topic. Although, as a high schooler, there's not much we can do about the subject, it is important to be able to understand the pros of Medicare for All. My goal is to persuade my fellow classmates to be in favor of Medicare for All in order to solve the problem of people in America being uninsured. So that we can have a cost-efficient healthcare system and have healthcare as a right and have a stronger and healthier population. Today, I will discuss the problem of Americans not being insured. I will outline why Medicare for All is the best solution to this problem and then talk about the benefits of Medicare for All. First off, I will be diving into the problem of this speech. There's a very large number of Americans that are uninsured. For every 1 million Americans that are uninsured, 10,000 of them will die. With over 28 million Americans lacking health insurance, this means that 28,000 of them will die because they are unable to access the health care that they desperately need. Life should outweigh any other factor when thinking of terms of healthcare. Therefore, implementing Medicare for All would be the best option to provide everyone a chance for healthcare. Medicare for All is the most cost-effective option for healthcare. According to Centers for Medicare and Medicaid Services, we spend over $10,700 for each person each year for healthcare. Meanwhile, Canada, Germany, and the United Kingdom have universal healthcare plans, and all of their capitas are less than half of ours. Not only are they paying less for their health care, but they are also getting better results than the United States. For example, our life expectancy is 2.5 years lower than Germany's. A study done by Yale epidemiologists found that Medicare for All would actually reduce the United States healthcare spending by 13%, or $450 billion per year. This means that in roughly a 10-year period Medicare for All would cost us about $37.8 trillion. And we would actually be saving about $5 trillion along those 10 years. We would be able to save this much with Medicare for All due to the reducing of administrative costs and the government being allowed to negotiate prescription drug prices. Just with our government negotiating prescription drug prices, we would be able to save about $250 billion per year. Now moving on to the fact that healthcare should be a right and not a privilege, and Medicare for All is the best way to ensure that. The United States shockingly reported to the UN in 2015 that they failed to recognize healthcare as a human right. Rather, they used the words measures instead of right. The UPR report of the United States government, Section H, paragraphs 100 and 101. The ACA, Affordable Health Care Act, is the only progress we've made in making healthcare any cheaper. But surprisingly enough, the ACA is actually a health insurance law and not a health care law. The United States refuses to admit to the UN that they have made virtually no progress in making healthcare a right. There are tens of thousands of deaths in the United States per year just due to the lack of health care. The uninsured have a higher risk of death compared to privately insured, even after taking into account socioeconomics, health behaviors, and baseline health, according to Harvard graduate Andrew Weibler. Finally, getting to Medicare for All will lead to a stronger and healthier population. The United States ranks last among other wealthy countries in preventable death in women giving birth. Actually, the CDC estimates that about 60% of these deaths were preventable. There are many benefits when it comes to Medicare for All, the biggest benefit being that it will help save the lives of the uninsured. Medicare for All will also help us save money in terms of healthcare, and it will ensure that that Americans are not paying too much for their healthcare. If the government were to enact a Medicare for All Act, then the United States would have a cheaper healthcare system. Healthcare would be considered a right and not a privilege, and we would have a stronger and healthier population. Furthermore, it is the government's responsibility to enact Medicare for All, and life should be put above all else. Medicare for All is the best solution to help the uninsured. I propose that we should implement a Medicare for All Act to help keep the population healthy. Thank you.